All right, so we'll go ahead and get started. We do see that we have some participants on WebEx, and hopefully everyone is hearing us okay this afternoon. We are already in session 7 of talking about the operations plan portion of the DSME business guide. So thank you for spending your time with us here. This is Meredith, and I work with Telegen. We are contracted with the Centers for Medicare and Medicaid Services to help increase utilization of diabetes self-management across the state of Colorado. And Inka is also on the line. Inka?
Good afternoon, everyone. My name is Inka Deku, and I work here at the Colorado Department of Public Health and Environment, and I oversee the diabetes self-management education program work to help promote the program throughout the state through a CDC-funded grant. And so one of the resources we provide is this technical assistance call. Thank you for joining.
So the intended audience is for ADA and AADE programs, although if you don't have a program and are interested in starting one, you're certainly welcome to stay on the call. Really, as we talk through the DSME business plan guide, we're thinking of this as the umbrella, if you will, of your DSME program. So under that umbrella sits your AADE or ADA DSME program, and then within your program sits your DSME clinical quality improvement, which is just one piece of what you all have to adhere to be recognized or accredited. So we hope in some form or fashion that these calls will address a component of each of those and help break a business plan into bite-sized pieces that you can either update or create based on what we hear section through section on the calls, and also allow for fair sharing. So our housekeeping items, we ask that you place yourself on mute by pushing *6 on your keypad. You can also use that to unmute when you'd like to add something. Please don't place your line on hold, because that lovely hold music is a bit distracting to the call. When you're speaking, please let us know who you are. We'd like to hear from as many as possible through the call. It's a pretty quick call, so if we can all be mindful in sharing fairly succinctly so we can move fairly rapidly through our short time together. We appreciate that. We have chat open. If you have questions or comments and we have time to address during the call, we'll certainly do that. If we don't have time, we'll be glad to follow up after the call with anything we see through chat. And we always record these meetings, and the meetings are made available, as you know, from follow-up that Inka sends after the meetings. So this is how we like to see who is joining us. For those of you on WebEx, if you could left-click on your pen up in the upper left-hand corner, left-click on the arrow, and then drag your arrow over to where you're located in the state. That allows us to see where everyone is located that's on the call. Do we have anyone on the call this afternoon that's not on WebEx? Great. And is anyone having issues getting their name to pop up on the calendar or on the screen? All right. Good to see you, Dawn. And Barbara, Inka, and I are located here in Denver.
And then I see that Mary O'Gara is on the WebEx, so I'm not sure if she's on the phone.
This is Mary O'Gara. I'm having trouble with that little icon.
Great.
Uh-oh.
Make sure you were on the call.
And Mary's joining us from Aspen, so we actually have some good representation across the state. So thank you. ahead, in case you want to go ahead.
I just wanted to go over the objectives for today's call. Last month, I want to introduce the national standards since those have changed. And as of May 1, all of our AADE and ADA programs are going to have to start following the 2017 standards. So I thought this was a great opportunity to kind of embed into our monthly sharing call. And so last month, we went over Standard 7, which was individualization. And so for today, we'll talk more about, since we're talking about optimizing our electronic health records, I thought maybe Standard 10, quality improvement, aligned with that. And so we're going to have a facilitated conversation on efficiencies and inefficiencies of a electronic health record system for the DSMES.
So on our calls, we always like to hear a bit from you. So once we read through the polling question, that'll open up on your screen, and you'll have 30 seconds to respond. Be sure to hit your submit button after you've sent your response. Our polling question for the day: if there was one thing I would like our DSME electronic health record to do better, it would be reporting functionality, interdepartmental or interagency communication, billing and accounts receivable, care planning and order sets, encounter documentation, other, or not applicable. We don't use an EHR at this time. So WebEx will go ahead and open up that poll, and if you could submit your response. All right, and it'll take just a few seconds for the results to come in. Okay, so it looks like we've got billing, accounts receivable, care planning and order sets, encounter documentation, and not applicable. And Inka and I, of course, are not responding to the poll, so thank you for sending in that information. And Sarah, thank you for being persistent in getting your arrow and name up on the screen. Do you want to just remind everyone on the call where you are joining from today?
Hi, I'm sorry. The map didn't show up on mine, so I was trying to get it to refresh, but I'm in Denver at Denver Indian Health and Family Services.
Great. Thanks so much.
So as I mentioned, we're going to be embedding the standards throughout our calls for the upcoming several calls. And so I wanted to highlight Standard 10, which is quality improvement. And as we start to think through, go through the facilitated conversation on EHR optimization, I just felt there was some alignment here. And so here is the standard. And so some things to think about I pulled out from the wording was operational measures. So thinking through participant satisfaction, financial indicators, no-show rates, or results of marketing efforts. Or thinking through process measures like participants receiving services, referral to DSMES, or referral to other services like an eye or foot exam. And so trying to just think through the EHR of what capacity you have to do more of your quality improvement work. And so there are a variety of methods that you can use for quality improvement initiatives, such as a plan, do, study, act model, a Six Sigma model, lean, reaim, or workflow mapping. And If these things are unfamiliar to you, Meredith and I would be happy to have further conversation on diving more into that if you need more technical assistance on that. And so we'll dive, I wanted to just ask, did anyone have the opportunity to watch the CDC webinar yesterday on the 2017 standards? Mary, I saw your name. You asked lots of great questions. Did anyone else have that opportunity to catch that webinar? And if you're on mute, I didn't hear anyone, but make sure you unmute yourself. But I did reach out to CDC.
I'm just answering. I took my mute off. I did not get a chance to see it.
Okay. And who was speaking?
This is Barbara Johnson from the
Oh, Barbara Johnson. Okay. Hi, Barbara. I did reach out because it was very good. I was really impressed. And I did reach out to CDC to find out when that would be released. And anything with CDC has to go through a clearance process. So unfortunately, at minimum, it's going to take 8 to 10 weeks for that to be released. But I will keep searching if there's other opportunities for a similar webinar. But again, Meredith and I are going to be incorporating more of the standards into our sharing calls as well. And then also, I know that ADA and ADE also are offering a lot of technical assistance and resources to ensure that you're meeting those standards by May 1st. So now we'll jump into our facilitated conversation. The next slide. So I wanted to dive into really thinking through some inefficiencies and what are some potential ways to dig into that and then come up with potential best practices or procedures or workflows to implement efficiencies. So I think I just wanted everyone to kind of reflect on their current EHR, and I know that we have one person who does not have an EHR, so you'll participate thinking through your current process. What are some inefficiencies, and then let's problem solve together of how we can make it efficient. So who would like to share? Start.
This is Mary O'Gara. I use ADA Chronicle, so the patients and all the data lives in Chronicle. So we have Meditech as our EMR. So I have to copy and paste and put the note in that EMR so that it goes out to the docs. And basically I can't get any reports from our EMR. Everything comes from the ADA Chronicle.
Okay.
This is Barb Johnson from La Junta. Can you hear me?
Yep, again. Go ahead, Barb.
Hi. I use the AADE7 charting system, and so all of my patients live in an online electronic medical records, and so I have to print out, for our hospital, print out the copy of all of the reports that are generated on AADE7 and take it to medical records so they can copy it into Meditech as well. I'm in a very small hospital, and I was essentially told when I started the program 4 years ago that we didn't have the resources financially to set up a whole new diabetes component in Meditech, so that's where I am.
All right.
This is Dawn in Kit Carson County, and we currently don't have any EHR, so I do everything by hand. I have tried using the AADE7, and it's just kind of awkward for me. So we are currently working on a pilot for the state for the Cerner Public Health Electronic Health Records. Us in Broomfield are working on a pilot. And it is expensive to do a module. So the cost of an EHR for a non-hospital or non-clinic setting it's a little bit cost prohibitive. It's $10,000 to add the diabetes module to the Cerner project that we're currently involved in.
Yeah, and Don, I met with the team that is doing that pilot project to get a better idea on, because right now it's limited to immunization, and there's two added, and then CDHS also is part of that pilot program as well, right?
Right, and family planning. So,
and family planning, right.
Hospitals that are being built out for us for family planning and immunization.
Yep. So I did meet with them and introduced myself and told them about the diabetes self-management and trying to expand with the local public health departments. And so as that pilot program evolves, who knows, maybe there's some opportunity and potential to expand to other diseases, chronic diseases like diabetes. So yeah, I got my finger on that pulse.
It's our intent to do that. We just have to find money to do it with.
Yeah. Yeah. So we've heard this in the morning call as well, where a lot of our DSME programs have their own kind of electronic record system for data, but then they have to upload, scan, somehow get that information to another system because of their hospital or clinics in order for that information to get back to the provider. But then there's that missing feedback loop from the provider to you all, and so thinking problem solving with that as well is something to consider. How do you all get information back from the provider? You just log into the EMR of the clinic or the hospital?
So this is Barb Johnson again, and you know, because I'm an outpatient based at the hospital, they really don't look to the Meditech for my information. It's just up to me to send them I try to send them a fairly detailed but brief, if possible, note on what's going on with their patients by fax.
By fax, okay.
For us, we don't have an EHR. We use the old-fashioned way. We fax, and everything that we fax to them is scanned into their.
Okay.
This is Meredith. I would ask the question of all of you on the line. I know that Health Information Exchange, CoRio, doesn't necessarily have capacity for DSME program information, but do any of you access either CoRio or QHN through the Health Information Exchange at this time?
This is Mary O'Gara. I use QHN, but again, it's limited. Like, you know, the endocrinologist, one of them is in Vail Eagle, and that practice is not on QHN.
Thanks, Mary. And the reason I ask that is I wonder, as we move forward, if there could be potential for having a conversation with the health information exchanges. But like you stated, Mary, it's only as good as those that are participating.
And they also charge, I think they charge over $1,000 a month just for me to have access, which I find criminal.
Oh, wow. Okay.
So right now, the problem-solving solution for a lot of these is having to do a lot of manual work from your existing data system to an EMR, EHR. I don't know if we just want to capture that, Meredith, on the slide, if you don't mind. And then we'll dive into the next slide.
Sorry, trying to keep up here.
Yeah. So, thinking through efficiencies and how to get there, what have you done to optimize or quality improvement cycles around your use of your EHR or your manual systems, Dawn? what have you learned and what have you changed? So what are some things you've done?
For the manual system, I put together, I have to pull out of my files. I have a goal sheet with a, it kind of says what the elements are that were discussed and when they were discussed and whether or not the patient verbalized or demonstrated understanding, and put that all in almost like a, I don't know, it's like a charting guide session kind of deal. And it has a place for notes if I need to. And that's what is faxed over to the physicians. And then there's also an instructions to patient that tracks their current point of carry, A1C, weight, blood pressure, BMI, and it tracks, and you can, each time you send it to the provider, they can see a comparison of the time before and the current numbers, and then the instructions to patients are right there, and the goal setting is right there, and that's also sent to the primary care providers. It also tracks their insulin or their oral medications and any changes. Of course, that's beyond DSMES. I'm also an advanced practice person, but it tracks any of the recommended changes I have in their medication. So I developed those, and I gave them to Cerner, so in the hope that when we do get to get this developed, that will be part of the workflow. So,
Great. Anyone else like to share how you've optimized, how you found something that was inefficient and optimized it in your EHR?
This is Barb Johnson again, and like I said, I use the AADE7, and it has some really nice setups for keeping track of, like the annual exams that they want done and the goals, but sometimes it's all in one big bundle. If you're charting about a group and you're telling them that you taught about nutrition, then it asks, did you set a goal? Well, I may have set a goal for 2 out of 4 that are in the class, but not everybody, so I tend to skip that part and just take the goal sheets that I have updated each class with each patient. I teach them, and we review at the beginning of each class, what are your goals? I have a printout for the patient. They review it, they rate themselves between 1 and 10, and they put down some kind of a comment, and then when I get back to my office, if I need more information, I'll call them. But then at the end of their training, I just communicate with the physicians here at the very end of typically their 10 hours or their 2 hours of refresher, and tell them what goals they had and how they did on them and if I have any recommendations. And I do that just kind of longhand in a fax.
Great. So you're really utilizing that goal sheet from the AADE7.
I do that a lot because when I make the quarterly phone call follow-ups that we do as well, sometimes you can't get them by phone, but if they've come through the classes, they already are familiar with the goal sheet, so I can send it to them with highlighters on the ones that I need them to update.
Yeah.
And, I don't always get them back, but when they do come back, they clearly know what's going on, because I've taken some time to teach them.
Great. Anything with the APA Chronicle, Mary, that you've optimized?
You mean for physicians? From yesterday's CDE program, I realized what I was not doing. I was not sending the docs the goal sheet. And within Chronicle, there is a goal page, of course, and you can run a report that would show the notes and the goal sheet, and that's what I think I'm going to have to start sending the docs to be compliant.
Okay.
So this is Barb again, and what I got from my docs when I first started this program was, don't send us all that junk. Abbreviate, or we don't have time to look at it. Has anybody else heard that besides me?
Oh yeah, I've heard the same.
Okay.
So what do docs want to hear? Just things are going okay, things are not going okay?
They set a goal for weight loss and they're down 8 pounds since this date. They don't want the details of every time that I've talked to the patient. I just had a patient that came for a refresher, and my note to the doctor was basically that this patient is doing okay with their diabetes, but they needed financial help, and so I spent almost the entire time finding resources. And another one who's not going to have insurance in March, and so again, I spent a majority of my time helping them to understand how to look up and how to use resources. So I tend to put in what I think is the important stuff.
Right. Yep. Yeah, and that's another big aspect that here at the health department we're going to be working more on is those other determinants of health, not beyond just diabetes education, but like you had mentioned, Barb, financial resources, food resources, housing resources. So your plate is getting fuller. Because if they're trying to manage their diabetes but they can't afford their medication, how are they going to manage their diabetes? So we're doing some work here at the health department to see how we can streamline those efforts. So more to share. Well, as we approach the 12:30, any last thoughts that you want to capture for inefficiencies or efficiencies? And then what I do is I combine the notes from this morning's call and this afternoon's call into one section in the email that I'll send out, the follow-up email. With the WebEx recording, I'm actually going to be able to, stay tuned for that for a more compiled list of what folks said on the phone call this morning. So we got a lot of good information and stuff that Meredith and I can move forward on to think through how we can support kind of existing data systems and getting into EHR systems. So there's less of that manual paperwork. Anything else, Meredith?
Not that I can think of. I think you covered it, and I just appreciate in our always short time together that everyone was sharing openly. So thank you for that. It definitely provides for more meaningful time together. So if we think about next steps, we'll be talking a little bit about the financial plan and projections of DSME programs. So under the first item here, if you aren't already, talk to your billing department or accounts receivable and ask them if they could provide you with a DSME billing report that details specifically any denied claims so that you can be identifying issues or trends with that. And it's a good time to put a plug in for Marianne Hedorowitz, which through our national contract with Telegen, we have access to Marianne for free consultation calls. So if you do happen to see that you're having claim denials issues, Marianne is really good at very quickly digging into those issues, knowing what they might be, and help you to get on the road of getting those claims paid. And then our next calls will be February 21st at both 8:30 and noon. You're welcome, as always, to join whichever call works best for you. So as we reference to some of the Colorado-specific data sources for diabetes, a lot of interactive maps and data that you can pull up through these different CDPHE tools. I encourage you to take a look at them when you're able, and they can definitely help inform your quality improvement efforts as having some measurable data to be referencing and looking at in the state. And last but certainly not least, thank you for spending your time with us this afternoon, giving us great feedback. You know how to reach Inka and I by phone or email. We're always available. Both of our websites are listed here on the slide, where you'll find a lot more with diabetes resources for the patients you're managing and your DSME program. And we'll have the WebEx eval, just a short eval pop up when you close out. If you would take a minute to provide us feedback so we can continue to improve. And we hope to speak to all of you next month. Have a great month. Thank you.